Welcome to Pause for the Truth, where you can sit back, relax, and hear an honest dialogue about health, wealth, legal, and social issues. The hosts are Dr. Rogers Kane, family practice physician, and Jocelyn Turner, health education consultant, with co hosts from the Northeast Florida Medical Society and its foundation. Stay tuned for the truth about matters affecting you and your family. We're here to tell you what's really going on and why. Good evening and welcome to Pause for the Truth. I am your co host, Jocelyn Turner. Oh, it's such a lovely day here in Northeast Florida. It's scorching, Dr. Kane. How about where you are today?
Yep, actually a beautiful day, sunny day. Is still scorching. I'm not that far from you, so I mean I can't pick up a rock and throw and hit you with it. But we got that same sun coverage, that same heat coverage, that heat dome, as they're saying on the news. So I'm looking for cooler days, but you deal with what you deal with whatever's put in front of
I don't know if I told you, Dr. Kane, last week, but I just came back from Alaska a week ago and I was complaining about how cool it was. I take that back.
I don't know why you're complaining of. You don't always put more clothes on. It's taking it off the clothes is the problem.
Exactly. Well, we are privileged tonight to have my good friend. We've been knowing each other for, to say decades make me sound old, but I'll say for a couple of decades, probably at least.
At least.
Victor Cora, how you doing this evening, Victor?
Johnson, I was telling Mr. Kane and Mr. Jackson, I'm running. You caught me yesterday at a time. I said, but this Johnson, I need to be there, but I'm running really crazy, doing a lot of great things. I believe in our community, but also, managing family issues and stuff like that. But I'm happy to be here so that we can share with our community some of the stuff that we're doing, what's going on, and how they can help and empower themselves when it comes to this subject of healthy brain aging.
And and to our listeners, if it sounds to you like Victor has a great on-air voice, it's because he has experience being on air. So I knew this would be an easy show tonight. We don't have to pull stuff out of him. This is right in his up his alley. So we're very pleased to have Victor. He's been a real champion in the community, advocating for no matter where he works, doing his own thing, freelancing, or if he's working for an agency, you best believe if he's attached to it, good things are happening for the community. So, Victor, let me ask you, and I say this, and you don't have to delve into it entirely, but if you're like me, both of us were doing our own thing, and then all of a sudden now we're working for someone. What brought you to the point where you are now with Mayo Clinic and the work that you're doing with the uh, what is it? The
The
brain.
Alzheimer's disease research center,
Mhm.
where we're looking for a treatment, to try to eradicate this disease that's plaguing, wow, approximately, over 7 million people in the country, and north of half a million here in the state of Florida. Where Florida has the second highest population of folks over 65 with dementia. And we've always been involved in stuff that's much bigger than we are. As I've been working the census for 3 decades, and about 11 years ago, Mayo Clinic came and wanted to make inroads in the Hispanic community, and they tapped on Arlene Ortiz, our friend Arlene Ortiz, and folks like myself to help them go and start talking about mental health and stuff, and especially in the communities. And fast forward, almost 7 years later, I'm still kind of volunteering to help. I had just finished in the 20 census, and an opportunity for itself to go and work at Mayo Clinic, which is something that doesn't happen every day and doesn't happen to everyone. So I feel really blessed to have that opportunity. And I started out as an associate research coordinator, which was just putting together packages, setting up studies for our community. And then the opportunity to become the mouthpiece came up, and I wasn't going to pass that up. So I became the program coordinator for outreach, and here I am almost 5 years later, trying to getting folks to advocate for themselves and sharing information that a lot of people may or may not have, Charles.
Yeah, we talk about brain health, and that's our topic tonight, brain health for all. Prevention starts now. I heard someone say recently that when it comes to Alzheimer's, people really started having symptoms. It's been told 20 years before the symptoms, the disease, if you will, started. What does brain health mean to you, Victor, in the conversations that you're having? And what should people think about when it comes to brain health?
Well, basically, brain health is body wealth, right? And I'm coining something that one of our partners, Bishop McGuire from the Potter's House, we're getting ready to start a series with him, and that's what we're calling it. We've put a couple of series together, and basically, we want folks to know that you have to keep this muscle active, that you have to stay social, that you have to exercise, that a body in motion stays in motion, and anything that affects your body is going to affect your brain. And we want you to know that you have the tools within your own pantry, within your own body, within your own mind to keep your brain functioning. And you and I, we talked around retirement, but some of those things that retirement is overrated, right? But because a lot of us retire and then we decide to stay home and do nothing and watch TV and not keep our brain functioning, either through learning a new word, either, exercising, socializing, because if you don't use it, you're going to lose it. And you mentioned about, the 20 years and stuff like that. And yes, that is the protein that causes and affects the brain, which causes dementia, does start living and start wreaking havoc in our brain about 20 to 25 years before you get up and you don't know which way to go to get out of a room. So what we're advocating and we're showing our community is ways for them to be able to stay active, to be able to keep this brain functioning, and also to help the community trying to find a treatment for this disease.
Yeah, Dr. Kane, I have to call you out because when I retired 6 years ago from the health department, before I retired, and Dr. Kane and I also go back 3 decades probably, but he said to me as my physician at the time, "So what are your plans when you retire?" And I said, "Retire, do nothing, sleep late." And he was like, "Nah, you can do that about 2 or 3 months, 4 max. And what you gonna do after that?" And I'm like, "Sleep some more, go to a different room and lay on the couch or whatever." He's like, "No, nope." He said, "I've seen throughout my practice so many people who retire and do nothing." Dr. Kane, is that why you promote it more? Because you've seen folks who do retire and just do nothing and just kind of lose it?
Yeah. Well, what Victor said a few minutes ago hit the nail on the head, and that is if you do a comparison of your body's health, let's look at just muscles mainly. Okay, if you turn around and don't, you do absolutely nothing that requires exercise, you sit around and do nothing all day long, you start losing muscle mass. It's just one of those things, like what you said. If you don't use it, you lose it. Well, the brain and its function is very similar. You need to exercise just like you do with muscle. If you want to maintain muscle mass, you have got to put some resistance to those muscles, so that even the muscles have memory when it comes down to doing certain things. And so they begin to enlarge like what you want them to be. But if you don't do anything, then those muscles will become very flaccid. They lose the mass. And then now you're lucky to be able to pick up a sheet of paper, no less a box of paper. So what he said was absolutely correct. Let me just point out a couple of things when we start talking about dementia. I just want to make sure people understand, I'm just going to talk about the major types of dementia. Obviously, the number one is Alzheimer's. It's the most common dementia. And it's caused by a buildup of certain proteins like amyloid and tar in the brain. Then you have the vascular dementia, and that's usually caused by reduced blood flow to the brain. Often the things like stroke or some other small vessel disease. You got Lewy body dementia, not seen that often, neither frontal temporal dementia. And then you have that mixed type of dementia where you have both Alzheimer's and vascular. Okay, and so there's some differences in them. I just wanted to make sure when people hear us talk about dementia, that I know most times when we say dementia, people automatically shift to Alzheimer's and think that is the only cause of it, or the cause of dementia. But you have those different types of dementia, like I just mentioned. And of course, we all looking trying to see what kind of age. Most of the risk increases after the age of 65. There's a genetic, as far as when it comes down to, especially with Alzheimer's, there's a genetic possibility, in terms of family history. Cardiovascular disease, when we talk about that vascular dementia, that's why you see us on here all the time talking about high blood pressure, diabetes, stroke, all of those damaged blood vessels, which the brain needs a very good blood supply to maintain itself in terms of its ability to function. Things like smoking and just inactivity, as we talked about a few minutes ago, and just plain old getting fat. Those things are things that need to change because they are risk factors. And then, of course, especially in our community, which Victor may get into it, there are those social determinants of health, that also play a role in dementia. Educational disparities, economic inequalities that we talk about all the time on this show as well. Inadequate health care, especially inadequate health care access, especially as it relates to African Americans.
Yeah, we say over and over again, Dr. Kane, it's interesting you mentioned that. We say over again from various conversations or health topics, the importance of exercise, and for Victor to mention the importance of exercising as it relates to our brain. A lot of people think, well, when I retire, I just don't want to do anything, or I'm just too tired, right? But you have to fit in some type of exercise. As I told people, when people will tell me, compliment me, one of my friends saw me going in the gym one day and text me, "Oh, that's so good that you exercise." It's like, I don't do it because I like to. Trust and believe. I don't like it, right? I do it because
you like to, but go ahead.
I do it because I need to, right? In so many different ways. So, Victor, talk about how Mayo Clinic is promoting brain health in the community, especially among underserved populations.
Well, that is my whole life right now. So I'm always looking for opportunities to gain access into different organizations, different communities and stuff like that. But I wanted to kind of add a little bit to what Dr. Kane was saying. There's a couple of other areas that we want to make sure that we look out for, especially when it comes to anything that affects the brain. So you want to try to limit any type of traumatic brain injuries. You don't want to fall and hit your head. The other thing is, obesity, hypertension, but hearing loss. Hearing loss has been contributed to dementia, because if that part of the brain isn't functioning properly, then that part of the brain is not being used, and it doesn't take plaque and tau, because amyloid, the amyloid protein is the protein that camps out in between the neurons of the brain, right? But the tau protein is the one that's inside of the cells. So we have imaging to find out where the protein, which protein it is, and where it is, and what part of the brain is camping out in, so that it kind of gives us an idea. And I appreciate Dr. Kane saying that dementia is the umbrella term. And, dementia is anything that affects your cognitive, memory, that affects your daily life. But not all memory loss is dementia, so we have to make sure that we check our B12, our urine, we may have a urinary tract infection. There's other things that may cause dementia. So, memory loss. So we want to make sure that we stay on top of our numbers and we know our numbers. But what Mayo Clinic is doing right now, we have a robust ambassador program, and I've been in members of different communities, and different organizations. But we have a group of Hispanics and African American, because we have two ambassador groups going on right now that get us into the community, that advocate for us, so that we can go into churches, community centers, festivals, anywhere that people are gathering. And we're not looking, obviously the bigger the number, the better. But right now we're about making sure that at least one person, two people, three people know what information we want to share with them. And like I told folks, we don't go in there asking folks to join research, although that's part of what we do. But we make sure that we go in there and we educate, inform, and empower our community so that they know, Jocelyn, that there is something that we could do to slow this process down, that there's things that you could do to keep your brain active. And as far as healthy eating good, brain food, blackberries, strawberries, avocados, good fish, good food, and antioxidant, that you can work on your balance and structure. Because, as we get older, our balance gets affected, our structure gets affected. We want to make sure that we protect ourselves so that we're not falling and hitting our heads. And also, making sure, like you said, try to learn something new every day. I feel really blessed to be working at Mayo, because I'm sitting there talking to all these scientists, and I tell people I could barely spell research, but I learned something new every time I talk to the scientists that are really excited about what they're doing. We just did a tour at Mayo Clinic, and the day in the life of a research participant, and we brought our ambassadors in because they can't speak for us if they don't know what's going on behind the scenes. So we gave them a tour. They see exactly what our research participants go through, but then we added a little bonus and we took them to the bio lab so they could see what happens to all the blood, how the blood is tested, what information we're trying to get out of it. And then we took them also to the pathology lab to see, the brain cutting and how they tested and looking for dementia. A brain that is completely healthy weighs about 3.5 pounds. But once you get plagued with dementia, your brain shrinks down to about a half a pound, because it's just and you can see it under a microscope, the difference between a brain that's demented and a brain that's fully healthy. And you asked what we're doing in the community. We just this past Saturday, we did a men's health in partnership with our cancer cohort. And I did some memory screenings, and that's nothing simple than just going through a small little test just to kind of set a baseline as to where you're at in your memory. We're getting ready now to do a project with the Potter's House on the west side. We're going to go in, talk about Dementia 101, and then offer some memory screening. We do panel discussions. We bring doctors, caregivers, and professionals in to talk about healthy brain aging, dementia, Alzheimer's, and anything associated with it. And every time we speak, somebody gets an aha moment. Oh my goodness, I didn't know that. I want to do my part. How can I get involved? So we're putting the information out, and we're really excited. We have a robust summer right now of information. We just finished celebrating, we're still in Brain Health and Alzheimer's Month. The Jacksonville Sharks did, a promotion for us. People are now starting to really wake up, and want to help and want to be a part of this initiative.
Yeah, it affects so many people. I can say even in my own family, I think about my cousin. I remember when he first told me, he's deceased now, but I remember he first told me that I don't know if he told me or his wife did, that he was having some memory issues, and he was like 60 or 61. And all I can remember is he and his wife, she retired first, and the plan was for him to retire, and they start traveling, doing the things that most people look forward to as they have worked 40 or 50 years. And so then he had that devastating diagnosis. And I tell you what, I just remember how he just went down so fast. It looked like it progressed so fast. So, at the onset of our conversation, we were talking about how it started years ago. Dr. Kane, what are some symptoms or signs that people can look for even at an early age so that family members can maybe identify, wait a minute, something is not right, or should they not worry about that and just make sure they're going in for routine examinations with their primary care physician?
No, well, I mean, they should make sure that they're going in for routine examination of the primary care physician, but the more direct answer to your question, the better answer would be it, it, it depends on what stage they are. Early on, sometimes we may just write this off. Family members write it off as just being forgetful. You know, they may lose, like, what did, you know, you and I, all of us have walked into a room and go, what did
I come in here for?
What did I come here for? And then as you begin to walk out, it's like, oh yeah, now I remember. So, you know, that is part of a natural process. But sometimes people actually put stuff down, cannot remember where they put it. And, you know, some of the defensive mechanism is that they start blaming other people for them losing those things. You know, and those other people wondering, what are they talking about? As it relates to waiting to go to primary, for them to see a primary care doctor, you got to remember sometimes these guys are in a hurry. They're trying to see XYZ number of patients in an hour. You know, sometimes it's dictated by who they work for or just the circumstances. And so the few minutes that they have with a patient, a lot of time what happens is that that doctor doesn't have enough time to pick up on it. Okay, I've ran into that situation where, you know, that patient, they come in by themselves and they do very well, especially that first 5 minutes of your conversation. Okay. But if you start talking to them a little bit longer and probe a little bit deeper, then you begin to see the little pitfalls in terms of their cognition and their memory. And that's when you need to start doing other things in terms of trying to do like some of these mini
mentals.
Many mental exams, you know, anything from the, you know, the mini cog and stuff of that nature. But these mental exam in which Medicare is asking us for the Medicare patients, they're asking every year to do a mini mental status exam on our patients and document how well they do so for comparison to the next year. Okay. If you notice something is off, or if you notice that they failed that exam, I'm not going to get into the total details of the exam, but if they notice that they failed that exam, then it becomes incumbent upon that primary care to dig deeper in terms of what is going on with that patient. Okay. And so, you know, that's when you may decide, depending how badly they flunk that exam, so to speak, for lack of better description, where you need to send them next. Do you send them to you can send them to a neurologist and they can do a neuropsych exam, which is a very detailed exam in terms of that patient's neuropsychological functions, in which they definitely can identify if there's any kind of dementia or anything else going on with as it relates to that patient's memory. And of course, depending on what stage you are in those memory loss, it may not be that bad the first time you do it, but that's why you repeat it again and see what the progress or lack thereof in terms of them improving, or sometimes they just, well, many times they just get worse because they still go back home and do some of the same things they've been doing and don't make any changes to their lifestyle, like what you guys discussed earlier. You know, diet, exercise, proper diet and proper exercise to keep that brain as sharp as possible. But that is just kind of on the surface of the things that we look at. And when you're in that office with that clinician, or if your family member's in that office with that clinician, then that's what we look at. One of the things I want to make sure I stress out to these family members, if you notice your mom, your dad, or, you know, your favorite aunt, uncle, and sometimes I have the parent noticing it in the kids, because, you know, your kids can be 60, 65, you know, and they become having dementia. I got one lady, she's sharp as tack at 96, but she's the one trying to take care of her youngster at 66 with dementia, you know, and she's the one brought it to my attention, both being patients. And so that youngster, when they get in, they knew how to play the game and not throw not throw my spider senses off in terms of detecting that, wait a minute, something's wrong here. This person is not the same person in terms of their mental capacity that I remember I've been talking to for the past umpteen years or whatever it may be. So that's when you get very aggressive and go start looking with that. Sometimes it's not so easy to get that consent from that patient because nobody wants to admit that they have dementia, that they lose a memory and get very defensive. Sometimes we'll lose patients because you even suggested that. And I have to make way for making, if I'm starting trying to, if I begin to feel like some of that is going on, I got to pave the way, with that patient to be able to bring that, the memory loss into focus so that patient can accept it.
Yeah, and as we talk about brain health, Victor, thank you, Dr. Kane, for that, awesome explanation. Victor, what are some challenges you see in reaching communities regarding brain health education and services? And is it difficult engaging people or getting them to show up to these conversations and activities that you all are having out in the community?
All the above, and to Dr. Kane's point, we're embarking and partnering up with primary care physicians because they are the trusted voices, of the community, of the patient, because, no one is going to listen to what I have to say because they don't know me. They don't trust me. That's why we're trying to partner up with our local primary care physicians to share what resources we have in case they do encounter a patient that they believe may be suffering from memory loss, that they can offer an outlet, through Mayo Clinic, whether it be through our longitudinal research studies, because you have to go back and revisit every year to see if there is a decline in memory. And, some of the challenges, selling health is one of the most difficult things. I've sold a lot of things. I've sold air, I've sold sand, I've sold a lot of things, in the time, but selling people on their own health is really challenging because, number one, some folks don't want to know. They're in denial. They don't have time. They don't think it's, for them. So, we have to cut through those barriers. That's why our ambassador program that we have is so robust, because they are the trusted voices in the community. And most of the ambassadors that we have walked the walk, with dementia. There's a couple of areas, also with this disease that we need to touch on, and that's the caregiver. The caregiver is the forgotten patient. The caregiver is that individual, man or woman, that is trying to take care of a parent, but also has a husband or a wife or kids that they also have to deal with. It's right now there's approximately almost 1 million caregivers, in the state, right now in the state of Florida alone, who are providing $1.4 billion of unpaid health care. And not only that, it's the physical task that it takes on their body, when it comes to depression, when it comes to physical ailments. And sometimes the patient outlives the caregiver because the caregiver is trying to juggle so many things, in the family and in the household. So we at Mayo Clinic, we're also offering different programs, for caregivers. Today, we just launched a program at the zoo we call Wild Wonders, where we take patients and their loved ones to the zoo just to give them a couple of hours of respite. You asked me how difficult it is to get in the community. We're making inroads. Folks are starting to call us for us to go. We have partnerships with the city of Jacksonville, different churches, different organizations, but it's getting people to come and also participate in what we're doing. And those numbers, we're starting to see a difference. More people are interested. Alzheimer's and dementia is really prevalent now in the news. So you're hearing more stuff about it. We're trying to get the younger generation engaged, because 1 in 5 people that are listening to us today is going to be affected by this disease. Either they're going to get it or someone in their family is going to have it, and they're going to have to become a caregiver. And my hat's off to every caregiver that's out there. We know what you're going through, but just know that you're not alone on this island. And we're trying to make sure that you have what you need in order to be able to manage through this phase in life that you just kind of been thrown into. and watching your mom or your dad or your uncle or your husband kind of just wither away in front of your very eyes is very painful, very stressful.
You know, Victor, it's very important what you just said, because that is one of the other things I have to deal with, trying to bring. I often have to ask those caregivers, "How you doing?" Okay,
Correct.
and then sometimes conversations with those caregivers have to take place outside the presence of the patients, because they get concerned that that individual is going to get mad at them for talking about them. You're telling the people that I'm crazy and all this. So that kind of stress on the caregiver trying to deal with the emotions, especially those angry emotions associated with the patient themselves. In addition, we got to remember those caregivers got to make a living for themselves or their families. And so trying to take care of mom, dad, and spouse, as uncles, aunts, especially, you know, we have people who they got relatives that have no kids themselves. And so a particular relative, I give all kudos to them that they step in and take on the responsibility of being a caregiver, and not just let that individual be left, you know, to fend for themselves and not have anything to eat and not have any, checking to make sure that they're still in good health, taking them to the doctor, all kinds of stuff that you'd have to do as if you had kids, because that old African statement, once an adult, twice a child, it does happen. And so sometimes you
Mhm.
wind up taking care of another child that's older than you.
Agreed.
Yeah,
Agreed.
since
Because
we,
things.
oh, go ahead,
Go ahead.
Victor.
No, I mean it's the whole caregiver saga is an entity all in its own, and the other thing that we tend not to to kind of overlook and sometimes not think about is the effect of that caregiver's missing work, of the effect of dementia in the business community. Just think about the fact that 6 in 10 caregivers were employed in the last year, right? But 57% of caregivers either had to go into work late, leave early, or have to take time off. That affects productivity. And individuals have to, kind of, let's see, they work an average of 35 hours a week. So now your productivity is being affected, your wallets are being affected, because if you're not on salary, you got to take PTO, or if you're hourly, you're not going to get paid for those hours. And about 18% of caregivers went from working full-time to part-time and eventually had to retire. So when you think of the effect of dementia, not only in the home, but also in the workplace. That's why I'm out there, talking to, business chambers, because with business, you have to talk bottom line. How is
Right.
this disease affecting your bottom line? So how do we make adjustments for that, either by more training or understanding that you may lose a caregiver because of what they're going through, in the household and stuff like that. I'm sorry, Jonathan, but I have to piggyback on that because those numbers are important. And that's an area that a lot of us don't really pay a lot of attention to, but we
Mhm.
should, as these numbers continue to grow, especially here in Florida.
Yeah, and just to talk about, when you talk about caregivers and you talk about people who are dealing with it and sometimes probably feeling alone, I think that's when it's important, in my opinion, that the village has to rally around that family that's dealing with it, right? Recognize, and don't just say, "Oh, I'm so sorry that you're dealing with that." Say to that person, "I know you're dealing with a lot. I know you're juggling your own health and trying to manage the health of your loved one. What can I do to help relieve that stress for you? Can I come and sit with your loved one maybe a couple of hours or an hour while you, at least that's time that you know that you don't have to worry about your particular loved one." Excuse me. I was talking to some folks from Africa recently, and they were just sharing how in their culture, that's why you see such big families together, And if a person is single, they make sure that and I'm not going to get into the particulars, but they make sure that the younger folks help that older person, that person, the village, if you will. That's why that saying about it takes a village. The village kicks in, recognizing that that older person may need help. They may not have dementia or a memory related issue, but they may have some other issues. If you're just tuning in, we're talking about brain health. Brain health is a very important topic that so many of us are dealing with in some shape, form, or fashion. It may not be anyone in your particular family right now, but as Victor said, 1 in 5 people are probably going to experience some type of memory issue with someone in their family. If you have a question, post a comment. Dr. Kane, can you comment on that question? Is there a correlation between obesity and dementia?
Yeah, I will. One thing I do want to say to Victor's point, approaching the business community, because they got to remember that good employees, you're going to have an excellent employee, and you just really like the way they do the work, their work ethics. But their work ethics may appear superficially to be slacking all of a sudden. But it may be because they are busy trying to take care of that loved one. And in today's society, where some of the business can now actually allow those caregivers to work from home, it'll be beneficial both to the business and the caregiver and the patient. I'm not saying that's a situation that will fit every circumstance, but it's something. If you're a business owner, you really need to look at how can that work. And I can personally say that I am participatory in a situation like that, where I have an employee that I have them answering the phones and stuff from home, thanks to the phone over the internet advancement that we have these days. And so when they call my office, that employee is able to answer the phone as if they're in my office. And it's not cutting out any, as a matter of fact, it's probably enhancing the scheduling process and stuff like that for my office. I could get some automatic scheduling and stuff as far as it relates to efficiency, but it doesn't help with the narrative of trying to help that village approach that you're discussing, Ms. Turner. Now, as far as what you're asking, is there a correlation between obesity and dementia? Yep. There is a 2020 study that was published in Neurology that found that a BMI, in a waist circumference in midlife, that a higher BMI and a waist circumference in midlife will significantly affect or significantly associated with lower brain volume. Victor mentioned the loss of brain volume before, and he talked about the tau proteins, and he discussed the amyloid proteins with the tau being inside the cell. So you're destroying that neuron directly. Remember, the neurons is the one that help you have that memory capability. But what we also need to remember is that one neuron may connect with thousands of other neurons. And when it comes down to that amyloid protein, even though it is not inside the nerve cell, it chokes those connections, okay? Connections that, as I'm talking right now, my ability to be able to speak involves probably thousands of neurons, because I got to remember what words mean and how to pronounce them, and enunciate whatever it may be, And it's automatic, okay? Until those nerve connections start getting choked off by that amyloid protein. And that's when it becomes very critical. It may get to a critical point of no return. And that's why we want to do some things to enhance that nerve connections, like certain things you do. Victor may get into that a little later, but certain things you do that can improve people's memory that ain't necessarily related to drugs. Some people got this music connection. I had this one lady, she had dementia, and whenever she used to be a piano teacher. she loved her music, okay? And the daughter was just totally frustrated trying to find something for her to do. She bought her a piano. And boy, did that take care of a lot of her things during the day. She just played the piano and so on and so on and so on. So it's something as simple as that can be very instructive and very helping toward these Alzheimer's patients. You just have to figure out what it is. There's a whole lot of things, other things that we can do, which I can put in our online and we discuss it later. But that's one of those things that we really do want to take a look at on what can we do to improve the memories of our loved ones that don't necessarily involve drugs. I'm not saying don't use any medication. I'm just saying what you can do at home on a regular basis to help improve the memory of our loved ones.
Yeah, Dr. Kane, for years I've been playing Scrabble, and people say, Scrabble, that's boring. I've been playing Scrabble for decades. And now that I don't have anybody that I can play with, typically you play with your siblings, and then I would play with my friends. But now, since I actually have the app on my phone, and I play Scrabble every single day of my life. I mean, literally, I have to put the phone down. I enjoy playing it that much. But some other mental workouts include puzzle solving, like crossword, Sudoku, logic puzzles, memory games, or matching card games, learning a new skill, language, and when you mention an instrument, a hobby, reading and discussing books. So as people talk about, start thinking about when the holidays come or birthdays come, and people think about wanting to buy their loved one or friend or whatever a gift, start buying things like that are intentional, that really will help those individuals in terms of stimulating their mind. Sure, a nice dress, a nice handbag is good, but something that's really going to help that person stay healthy in the long run is good. Or a gym membership, right? Encourage people to know what their health insurance plans offer, because as you age, folks on Medicare, they might be able to get silver sneakers or some other discounts for programs. Victor, I wanted to ask you.
Ms. Turner, one real quick. The only other thing that, don't forget these electronic devices. Even though a lot of old folks, they're not going to be able to do all that texting and Facebook and stuff, but those electronic devices have a lot of games on them, okay? And there are some memory games on them. I think Mayo has some other routes in terms of directing people toward games of that nature. Victor, you can comment on that if that's the case. But different games that they can use to help enhance their memory. So it's not very expensive. It can be on their phone. And just making sure that they do some exercise to their brains, okay, and so on and so on. But
book clubs. I know book clubs are also a good thing, and it doesn't have to be a book that's 500 pages. But if you just, with your small friend group or family group, just tell everybody, hey, let's start a book club within our family or within our friend group, and get everybody to read the book. Whoever wants to participate, they can. And since, we like to get together to eat or, have some light refreshments and talk about it. And people don't realize that something as simple as that helps. Victor, do you have, in the 5 years that you've been doing this work, can you share a success story or moment that made you feel like you were really making a real difference in this work?
Jocelyn and Dr. Kane, is when I go out into the community and just talk to people about the subject that we're talking about, and I see the light bulb goes on and the aha moments of stuff that they hadn't heard and didn't know how simple it was to kind of start working on making modifiable changes. Because changes doesn't have to be all at one time. You can start by exercise. You can start by exercising, or you can start, by changing a little bit of the habits, your eating habits, the whole socialization piece of it, but when I share this information with people, it's watching the bulb go on and then having folks come to me after the fact, just tell me, wow, I didn't know that. Or how do you know how important that was? or listen, I want to do something to help find a treatment or something for this disease. So it's that's what makes me get up and continue to do this, Johnson, because I know that the community is gaining access to stuff. We talked a little bit about the social determinants of health. We have to make sure that the community has the resources and the tools that they need in order to make the best decisions possible for themselves and for and for their and for their families. And when people decide to join our research studies to try to find a treatment for this disease, that's also wonderful. That's because we've given them the information for them to be able to make decisions that's best for them and also best for their family.
When regarding your research studies, do you all typically just look for people who have been diagnosed with dementia, or do you look for people who are at a healthy stage as far as they know in their brain health, or both?
Correct. So we, depending on the studies, we look for folks that are cognitively normal, and some of our studies start as young as the age of 45. But we also have a couple of clinical trial studies. So we do, and that looks for folks that may be suffering from memory loss, that have been complaining with memory loss for about 6 months or so. So depending on the study, then that's going to determine which persons are qualified or not. We have observational studies, which is like, Dr. Kane alluded to, where you come every year and we test you. We do the neuro psych exams. And then, we do different types of tests where you have to repeat numbers forward and backwards. You have to repeat a story. So depending on that, we start with the mini mental, but then it just gradually increases. And then you see the neurologist. We also have scans, because we have scans to see if you have the amyloid protein, the tau protein, and also just simple, MRIs to see what's going on in the brain, in your brain activity. And then there's a PET scan that shows brain function, to see exactly what the brain is doing. And we encourage the community to at least investigate, especially if you have someone in your family that has suffered with this disease, for you to be able to get control. It doesn't cost anything at all, because some folks ask me, well, how much does it cost? Well, if you come in through the research shield of Mayo Clinic, you already pay for it if you pay your taxes, because we get funding from the federal government to be able to try to find this information. So you already pay for it. You just have to show up and hang out with us for a couple of hours once a year, as we continue every year to go back and be able to look back and see, has anything changed with this individual?
Let me even elaborate on that as well, because I've had patients that have participated in those studies. One of the things about, be quite frank with you, it is very those PET scans, those types of scans are very expensive to conduct, and a lot of them may not be covered by Medicare. Okay, and I mean they can be up in the tune collectively to the tune of about $60,000 worth of studies. Okay, that when you participate in those, when I say studies, I mean imaging and blood work and stuff of that nature. When you, when you participate in those kind of studies, you get the advantage of being able to get those kind of scans that can help us detect stuff very early on and see what's going on very early on and help make the diagnosis. Previously, only time we for sure knew the patient had Alzheimer's, or what they call, when we talk about dementia, knew if they have Alzheimer's, it had to do after a post-mortem biopsy, meaning when you dead, that's when we take a look at your brain, and then we can say, yeah, it was Alzheimer's. But that put us at a great disadvantage, because we need to know while the person is alive so we can see if there's anything we can do about it. They also have different blood work out there these days to help detect the presence of that Alzheimer's gene. And Victor, you may be able to allude to what they're doing over at Mayo with that, in terms of the blood work and serology that people are looking that people have access to at Mayo.
So right now, as you know, the FDA just approved a blood test to be able to determine whether you have the protein or not. And right now, there's now navigating through how that's going to work and who's going to pay for it and all this other good stuff, because it is clinical. But in our biolab, the scientists are constantly looking for ways to determine, the genetic makeup, whether or not there is, a way to find, through your genes, exactly whether or not, we're going to get this disease or not. You do it through lumbar punctures, but we don't, at least when I'm out in the community, lumbar punctures, I mention it, but we don't push it because I personally myself, this is something that I look forward to, right? So I like the idea of the blood of the blood test, but I also look at the fact that so far, right, when you remember 20 years ago, we didn't have any type of medication at all associated with this disease. Right now, there's two drugs that have been approved by the FDA, donanemab and lecanemab, that have been approved. If you have the protein and are not showing any symptoms, okay, that's the key. You can have the protein but no symptom. These drugs help slow the process down for up to 28%. Right. So those are two drugs that have been approved. Now there's a clinical trial study going on for the early stages of memory loss. They don't even have a name to it. It's a number. CT1812 is the name of the drug. That if you have suffering from memory loss and are in early stages of dementia, they're testing a drug to see what it does to the to slow the process down. But once you go into second and third stages, right now the jury is still out on that, and I'm sure that somebody right now is trying to find some sort of treatment to be able to slow that process down as well. But as the brain continues to dies off, it's hard to recuperate.
And yeah, and of course, people are, when it comes down to doing clinical studies and they just observational, we don't get as much resistance to people participating in those as we do the ones whom there are drugs involved.
Correct.
And because those drugs are not without side effects. And it's not to scare anybody, but they're not without side effects. They got certain issues that they have, and you have to weigh the risk versus the benefit, especially in terms of at what stage is that person in as far as it relates to Alzheimer's. But let's not forget the other causes of dementia, okay, when you're looking at them, but especially when it comes down to vascular dementia, that we need to look at those and trying to figure out early on people that may be suffering from that. And that also, when you just have a person who shows up having some dementia, that is one of the things that you kind of look at whether or not it's vascular in origin. You can do certain CAT scans and stuff of that nature that may help give you a hint. But one of the persons did, I had people texting me asking questions. So they asked about, what about optical scans to detect early stages of potential vascular dementia? And, those optical scans, when they look into the eye is the only place where you can see blood vessels that's not being obscured by skin or any other membrane of any kind. You can just see straight back to those blood vessels. And you may see cholesterol plaques and how bad they may be in those, within the vascular system of the eye. Well, that may just be a representation of how bad your cholesterol is in other places in your body. Anything from what the cholesterol look like in your heart to what they look like in the brain, erectile dysfunction, yada, yada, yada. So when you start looking at some of when they go to the eye doctor, that's one reason I keep pushing people, go get your eye exam, because that may help us lean more toward looking at other causes of potential causes of dementia, or that person may be facing dementia in terms of a vascular dementia. You still do the whole overall testing with everything, but it may be one of the first things that give you a hint that this person may be headed down the wrong road. And last thing, when somebody asks about, are smokers more prone to dementia? Yes, because the smokers are, if nothing but the vascular injury that smoking causes. It causes inflammation of the lining of your blood vessels. The smaller the blood vessel, the more likely you're going to have cholesterol escape within the walls of it and help block off some of the blood flow and so on and so on. Even sleep apnea. You think about it, it can be associated with dementia, because you got to remember there are periods where people, when they experience sleep apnea, your oxygen level drops down to like 70-some%. That means your brain is being starved of oxygen. You know,
Absolutely.
and so now you're causing not just vascular injury, but injury to the neuron, the brain cells, the whole thing that you're trying to avoid when it comes down to dementia. So we got to keep those things in mind, and hopefully our physicians that are listening will also start looking at trying to examine that in those patients. Even when you're not suspicious of dementia, just doing something as simple as having them do an eye exam may throw up a red flag or yellow flag, if you want to call it, caution flag, to go look.
Yeah, a few things you mentioned, Dr. Kane, between you and Victor that I hope people recognize, because I have a couple of friends who've been diagnosed with sleep apnea and they refuse to sleep with their CPAP machine. So I hope they're listening to know that it may be annoying. However, you're talking to somebody who's been dealing with it. I was diagnosed with sleep apnea 20 years ago. And the first time I slept with my CPAP machine, that was the best sleep I had in 20 years, right? And
Yep.
so I don't sleep without it. You should see when I travel, I panic. Okay, first thing I'm getting other than my purse is my CPAP machine, right? And I'm not, Victor, I'm not shy with sharing what my issues are. And the one thing you mentioned, Victor, that I'm also not shy about is hearing. I found out recently that hearing is associated with dementia. So there are so many, Dr. Kane, you talk about going in for your eye exam, get your ears checked. Again, get you a medical team to help you manage your health. And if you don't have insurance, apply for the current government-sponsored insurance plans that are made available to us. Victor, for someone who's listening, what's one small step they can take to protect their brain health? And how can people connect with you and your program to get involved in the Alzheimer's research and prevention?
So to answer your first question, again, modifiable changes. If you're not active or your body is not in motion, a body in motion stays in motion. Just get up and walk to the corner of your neighborhood and then try to extend that a couple of feet every day. If look in your cupboard and see what kind of stuff you can eat that can help, with your brain function. And talk to people, get on the phone, stay active, just a couple of things like that, and again, it doesn't have to be done you don't have to do everything at once, but focus on just making modifiable changes that you can keep your brain in function, so that either through eating or exercise or food consumption. And, if you need to drive a couple of extra blocks to be able to find some good, healthy food, then do that. And don't just settle for, if you live to just get whatever's available, because anything that you do to help, your brain, it's going to pay you back in dividends. And look for something to do. Yeah, it's always great to finish your career and stuff like that, but don't quit. Don't just stay watching TV, because it's not going to be helpful. And I laugh when you talk about sleep apnea, because I do also suffer from sleep apnea, and I was diagnosed over 20 years ago. And I tell people I would leave my wife on a trip, but I will not leave my CPAP machine at all, because it makes all the difference in the world. Like you said, I had to go to Atlanta one day and I forgot the plug, and I had to sleep sitting up, because other than that, your throat hurts and all this other good stuff, and it affects your brain. It deprives your brain of oxygen.
Well, the other thing is that look at with sleep apnea, and this just kind of a little caveat. There's a high association of sleep apnea with AFib. You see a lot of AFib today. And what you got to remember is when you got AFib, one of the big problems with it, they start throwing blood clots. And they don't have to be big blood clots going to the lungs or anything. They can be macro clots, macro clots, for lack of a better description, very small ones that may damage small blood vessels. But the cumulative effect that it may have on your brain function by denying oxygen flow to wherever that blood vessel leads downstream to those neurons may actually cause a certain level of memory loss, and again with dementia. So, and then one last thing, Victor was just talking, what he was saying right now put us in reminiscence of what our favorite dietitian says. Linda, when she says, get out there and, if it, what is it? If it, what's her favorite, Johnson, you love a favorite thing about if you,
you don't have to read labels on the foods that you need to eat.
That's right. You got to read the labels on the food. It may not be that good for you. So,
you don't need to read the labels on the foods that you're supposed to eat, which are fruits and vegetables.
Fruits and vegetables.
Correct.
Exactly. So, Victor,
and Johnson, you asked.
I was going to say, as we near the end of the show, I would like for you to share your final thoughts regarding tonight's discussion, and also how do people get in touch with you to get involved in some of the work that you're doing, and schedule maybe some opportunities for you to come out to their church or business.
So I'm going to give you the number to the clinic, and all you have to do is say, "Hey, I heard Victor, on the podcast, Pause for the Truth," and that is area code 904-953-6523. That is 904-953-6523. Just leave a message, say, "Can you ask Victor to call me back? I'm interested in either having someone come talk to our group, or I want to know a little bit more about what you're offering or what opportunities there are for me to keep brain health top of mind," which is what I tell people. Thank you for allowing me to keep brain health top of mind. And that's the key, and look for an opportunity that you always feel that you're doing something to create new cells. That may be learning a language, learning a definition of a new word, using a new word in a sentence, calling someone instead of texting them, and just minimize the fact that, you're the lack of using your brain, to be able to move forward and stay active. You have no idea how important it is to keep the blood circulating through your body and in your brain. That is something that is going to pay big, big, big dividends. And just make modifiable changes. Once you get it in your system and it's in your DNA, then you move on to making the other changes. Because if you try to do too much at once, then you're going to quit on yourself.
Thank you, Victor.
Don't
Thank you so much.
Say again.
Dr. King, what are your final thoughts?
To die. By sitting on a porch and doing absolutely nothing.
Absolutely nothing. Yeah.
You return to die.
Dr. King,
that's the recipe.
Okay, so my final thoughts actually is that there are a multitude of programs that try to help families and patients that suffer from this crippling disease, crippling not only to the patient, but crippling to the family members and their caregivers. Mayo has his clinical research program ongoing. There are other research programs out there that are also ongoing, but also not just research. We have to find ways for some resources for families, patients, some local resources, UF Health, Elder Care. And when I say UF Health, we're talking Jacksonville Memory Care. Baptist has Age Well. From a statewide standpoint, you got Florida with the Florida Alzheimer's Association. You also have a National Alzheimer's Association. NIH and NIA also have some resources. So there are various resources out there. And what we want those patients, because we can't just depend on trying to find some medications to treat these patients. You got to find routines that help them, put them in the better place to where they can feel good about themselves, because depression can also be a big issue associated with dementia, because if you recognize you have memory problems, tell me you might not get depressed. Okay, so you got to think about a lot of concerns that a caregiver and their families of these patients have, and try to help them out as best we can. But most importantly, the patient is the one that we really need to focus not only the patient, we're still the caregiver, but we really need to focus on that patient, because the whole reason that these caregivers are giving up their lives to the extent that they do is because they love those loved ones and they're trying to find what's best for them. So help out as much as you can. If you see someone in need, those brothers and sisters of the caregiver, because a lot of times I see one family member taking care of that patient, okay, and no help from anybody else. And they have brothers and sisters, and so just think about you. Don't just dump on your brothers or sisters, your mom or your aunt or whomever. Please help so that they can maintain their sanity as well, because being boxed into a corner where your whole life is nothing but taking care of someone else without any respite care, meaning somebody to come to relieve them of those responsibilities, can be very demanding, and even that can be very depressing, very depressing to those caregivers.
Thank you, Dr. Kane. Thank you for joining us for this powerful conversation on brain health and Alzheimer's prevention. Today's episode reminding us that protecting our minds doesn't start in old age. It starts now with the choices we make every day and the communities we build around us. From movement to mindfulness and nutrition to connection, we all have the power to support our brain health across the lifespan. And as we've heard today, equitable access to brain health education and prevention must be a priority, especially in communities that have been historically overlooked. A big thank you to our guest, my friend, Victor Cora from Mayo Clinic's Brain Research Center, for sharing your insight and your heart. Your work is helping to create a future where more families are informed, supported, and empowered. To our listeners, take what you've heard today and share it. Start a conversation with your family. Join a local health event. Look into how you can support brain health programs in your community. Every small step matters. Until next time, remember, when we invest in our minds, we invest in our future. Stay well, stay curious, and keep showing up for your brain. And of course, don't forget to like us. Subscribe to our YouTube channel. Take care. See you next week.
Twitter.
Good evening.
Good evening. I don't think we have an outplay today. So
are you ending it?
Yeah, I'm in the stream. I think
it's not ended, Dr. Kane. Mute.
Okay.
We appreciate you spending time with us on Pause for the Truth. Ms. Jocelyn Turner and Dr. Rogers Kane are grateful for your support. Don't forget to like us on Facebook, catch us live on Twitch, and most importantly, subscribe on YouTube. A big shout out to Tyrone Jackson at Call Tyrone IT Services for keeping us connected. Join us every Tuesday at 6:30 p.m. Eastern Standard Time for more enlightening discussions. Thanks, and see you next week.